Everyone, good morning. Today I will discuss with you all a disorder which is known as impulse control behavior disorder. Now, discussing in detail, I would like to discuss first about what is impulse, what is impulsivity. Why we used to say people that impulsivity is not good in every situation. Showing impulsivity is not good in every situation. Now, impulsivity is something like that when the person is not able to manage his emotions, his intense fear, and as a result, react to their situations. He is not able to manage the stress, he is not able to control the associative tension and anxiety, and he reacts abruptly in that situation, which we show that his behavior is impulsive. He showed his impulsive behavior. This is somewhat about when the person is in deep, intense emotions, feelings, where he is not able to differentiate it out that this behavior of mine will make me in a difficult situation. We consider it as a impulsive behavior. Talking about impulsive control behavior disorder, in that the same thing happen where the person reacts abruptly. There is a reason he is not able to react properly to that situation. As soon as the stimulus comes in front of him, he reacts abruptly because the emotion attached with that stimulus, the stress attached with the stimulus, he is not able to manage that stress. There are different kinds of impulse control behavior disorders like kleptomania, where there is an urge of stealing tendency, pyromania, where the person is indulged himself in setting fire, oppositional defiant behavior disorders, conduct disorders, where he is prompt to disobey the rules and the social rules and laws. These are the certain kinds of disorder of impulse control behavior disorder where we notice such kinds of being. In certain condition like in kleptomania, like in pyromania, there is a behavior like the obsessive behavior which compelled him to do such kind of activity. Again, talking about the reason and the causes behind such kind of behavior. There must be certain stress associated with that, and of course the deep emotions attached to that particular situations. A faulty parenting style, the family environment assessment, where he is not able to control its emotions, he is not able to look through his behavior there is in the situation. Because certainly we see in many people, like as soon as the problems comes in front of him, he is not able to manage and reacts. As a result, when he reacts, he finds himself in the difficult situations. Because at office also you must have seen that as soon as the stress and the burden of workload comes on us, we used to start reacting. Many of us start reacting and reacting in a particular manner which is not applicable in office. So this is the showing our impulsive behavior towards the stimulus. That is a reaction towards the stressful situation. Somehow there must be stress associated, the family environment, the trauma associated with that, or there is an associated other kind of psychological problems like history of substance abuse might be possible with that. Nowadays we all are seeing that people become many news channels, and in newspaper you come across the news every day that as soon as the person becomes angry, he showed a response in a very, very negative way. That is like murder, like any other antisocial activities are being involved. So this is something about the person is not able to control its emotion attached to that stimulus, and as a result, he reacts in adverse situations. Now the question arises how we are going to manage it out. See, management, that is a psychological management, there are few associated medicines are also can be given to the person. But if we talk about the psychological management, how we can manage it out. Remember that impulsivity is the reaction towards the stress. It's a reaction towards the unstability, its reaction towards the unstable emotions which you are not able to manage it out. Here, dialectical behavior therapy works very well, which is able to tolerate the stress associated with the situation. Tries to develop the stress, how we can manage it out, how we can tolerate the stress, how we can look before his behavior, the reaction. These behavior therapy, dialectical behavior therapy, basically focus on this only. And as a result, when you are able to tolerate these things, your behavior will be changed associated with that. Again, the cognitive behavior therapy, where your belief systems, where you have a thought regarding the negative thought and anxiety associated with that, you need to restructure it out. Again, we can work on the behavior techniques like systematic desensitization also plays a very focus involved in that. Apart from that, these psychological treatment, in general, I would just ask and I'll just request from everyone. See, being impulsive in adverse reaction is not always good. We need to show the reaction to the situation which is not according to our choice. It's very necessary. Here, our assertive training works. Like we should learn to say no with request. But giving impulsive reaction which might make us in an adverse situation, where then gradually our situation becomes worse. So we need to have a tendency to tolerate the stress to certain level, manage it out to certain level through the exercises, through the deep relation exercises, and of course you have to think before you react. When you think before you react, you have a judgment towards the stimulus. So friends, please do take care of yourself very well. Thank you.